those are the things that I typically look at
Okay.
when I'm just setting up my case. So this looks like it would be a workhorse, especially for implants and endo.
Yeah.
So that's awesome.
Okay.
So with that, you're not going to see the cervical spine. So usually that's one of my passes that I'll do. I probably still am going to do 3 passes. I typically try to keep everything exactly the same. I'm very systematic in how I review it, so I make sure that we don't miss anything.
Okay.
So I don't take any shortcuts as far as that goes, even when we have the smaller volumes. But I typically start up at the very top in the axial sections. So I'm going to start up here, and for this one, the most superior aspect is going to be the maxillary sinuses. And let me see, we're at, well, what, the midpoint inferior aspect of the sinus. Yeah, okay. So that's going to be our top where we're going to start.
Okay.
So things that I'm looking at as I'm coming down through, I'm going to look at my sinuses, and typically I go through the anterior aspect, come up through the airway, and I go down through the cervical spine. That tends to be kind of my MO there for my systematic pattern of review in the axial.
Okay.
But as I come down, I'm looking again, those maxillary sinuses. Of course, we can see we have mucosal thickening within the sinuses. We definitely would want to rule out an odontogenic source for that.
Mm-hmm.
But one of the things we see right off the bat is our cortical borders of the sinuses are nice and thin and intact.
Okay.
And so using symmetry, making sure that everything is rotated perfectly allows us to use symmetry. And so you can compare one side to another. Even if you don't quite remember all of your anatomy, you could go ahead and compare one side to another. So if it's nice and thin and intact, we know that whatever's going on is most likely an acute or allergic situation. Now, again, I think we might have a odontogenic source here for this one. So if you ever have any questions, you can put your crosshairs and look at it in all 3 planes. But as I'm coming down, I'm also going to look at my nasal septum. I want to make sure I don't have a deviated nasal septum as I come down. And coming into our maxillary dentition, we can definitely see we've got something going on. So I'll go ahead and put my crosshairs on that. Again, I'll look at it in all 3 planes. I'm assuming, can we enlarge these?
Yep.
Cool. All right, so we can look at that a little bit more locally, looking at our sagittal sections. And so we can see, definitely we've got something going on there. So go ahead and just jot that down. And how do we make it smaller again?
That first icon on the top corner there. You had it. You're in the right side.
Right. Okay. This guy.
Go to the left. There you go. Yeah.
All right. Cool. Super easy software.
Yep.
All right. I don't know my crosshairs one. Anyway, so all right. So we've checked out the maxilla. That looks, pretty good. We know we have an issue on tooth number 14. Coming down through, and I'm looking at cortical borders, looking at my incisive canal. Make sure that typically look at my root canals as well. Make sure we don't have any sort of internal root resorption or maybe opacification of the canal, letting us know that there may have been a history of trauma or anything like that. And we see a couple things going on over here. We do have beam hardening artifacts with our CBCT.
Mm-hmm. Could you explain what that is?
Yeah, so what happens is that the ray, as it's going around, it will hit something that is metallic, and it will completely absorb all of those X-ray photons.
Okay.
And it leaves behind it kind of this like a black appearance behind it.
Mm-hmm.
And so what happens is that the algorithms are expecting to see something, and they don't have anything there. And so it makes it really dark there.
Got it.
Sometimes we'll see white streaks with that.
Mm-hmm.
And that's because it's an error in the algorithm. It's expecting to see something that it's not seeing. And so we have this kind of streak artifacts that can go with it. So because of that, because we know we're going to have this artifact around all of our metallic restorations, We tend not to diagnose caries off of CBCT. My CBCT is amazing at everything else, but caries, I would say, very conditional.
Mm-hmm. Mm-hmm.
However, we might mention that it looks like we have some things going on, and you need to take some intraoral bite wings to accompany the CBCT to help rule out caries.
Okay.
Now, if the patient has no metallic restorations, we might go ahead and say, it looks like we have some coronal loss of tooth structure that may be suggestive of caries, but we don't come straight out and say they're caries.
Okay.
So we're kind of careful in our wording there just because we know that this can happen. All right, so once I've gone through my maxilla, I tend to jog up just a little bit, and I want to grab my temporomandibular joints, or the most superior aspect of my ascending ramus.
Yeah, so this
like
volume doesn't have, it doesn't cover that. It goes 8.5 vertical.
I would assume that if you have a small volume, like a smaller patient, you'll see them. Is that right?
That's right.
Yeah, but with a larger, you probably won't. But anyway, I go to the most superior because I want to start at the most superior aspect to that ramus and go all the way down through.
Okay.
And again, I'm looking at those cortical borders, wanting to make sure that everything is smooth and intact. So when I'm looking at things in my axial as well as my coronal, I am looking more globally in appearance. And when I come to my sagittals, when I'm looking more local.
Okay.
So we definitely want to review the whole CBCT. So I always go through all of the global evaluation first. So I'm coming down through, again, you can easily see we can compare symmetry. Obviously, you're picking up that mandibular canal so nicely, and that's really cool that automatically does that. That's fantastic. Makes it so easy. You can see exactly where that is situated in relationship to those third molars. And again, nice, smooth, intact cortical borders. One of the things with CBCT is we can't differentiate the soft tissues.
Mm-hmm.
So we're really keen on looking at those cortical borders because we know if the cortical borders are missing, it could tell us that there's some sort of a pathology within the soft tissues that's causing a erosion of the bone. So those are kind of things that we look for.
Okay.
Now, in this particular case, we can obviously see that we do have some thinning of the buccocortical border in this region, the anterior maxilla, and let's see about the lingual. The lingual cortical border, maybe just a hair thinned, but it's mainly the buccocortical border. Okay. And of course, we can always put our crosshairs on it if we are concerned about. Let me grab those. There we go. And we saw this before that we have a nice little lesion right here. So I'll go ahead and peg that. I'm going to come back at some point. I would measure that, look at all of the radiographic features with that. But for now, I'm going to keep going on down. There we go. All the way down through. And then I'll come up looking at my airway space. And of course, this looks like these are our little hyoid bones right here, there. You can see that very nicely. We just got a touch of them. We can see the epiglottis right there. So we know we're about the C3, C4 level.
Okay.
So you can kind of base that off of the fact that we see the hyoid bone. Even if you don't see your cervical spine, you know what level you're at.
Okay.
And this tends to be the level that we see calcified carotid atheromas at. So I'm going to look posterior and lateral to the airway space. They typically are going to be, out in this area, and they're going to have an arcuate appearance. These little calcifications will, because they're rimming the artery.
Okay.
But we don't see that with this case at all. So this looks great. So I'm going to go all the way up, there you go, through the airway space, making sure that everything looks pretty nice. All right, and once I've reached my top, I can just do a quick review, just kind of looking at that most posterior aspects, even though I don't have that cervical spine. And all the way down. Just making sure there's nothing going on in the soft tissues on either side.
Got it.
Okay. All right. So that's my look in my axial sections.